Before moving to Germany, I heard the same thing again and again. Good luck to a doctor's appointment. You will have to wait for months. German medical system is too slow. But after living in Germany for more than 2 years and actually visiting many doctors, specialists, dentists, being admitted twice into the hospitals, I would say one thing that my personal experience has been very, very different. And I want to tell you what exactly happened, the good thing, the bad thing, and the things nobody tells on internet. Nobody told me before I moved here. If you are planning to move to Germany or you are already living here, healthcare is probably one of the things you are worried about. But let's be honest, you can survive without a fancy apartment. You can survive without a mobile phone. You can survive without a car. But when you are sick, do you want to hear that your appointment is in next 3 months? No. Nobody wants to hear that. And that what I was actually expecting before moving to Germany. I was told on internet and I read everywhere that appointments takes months. But it's not as it is explained or told on the internet. My experience has been much more better than I expected. And I'm not saying that the German healthcare system is perfect. It is not. There are definitely problems. Nothing in this world is perfect. There is always room for improvement. But some of the things people told me about German healthcare system simply have not matched my experience. Let me explain. One of the biggest difference I noticed in Germany was the attitude toward medication. In some countries you go to the doctor, explain that you are sick and you are expecting to live with a prescription, with some injection, with some tablets. But my experience in Germany was sometimes completely different than this, than in my own country, Pakistan. I was sick. I went to the doctor. Instead of immediately giving me medication, I was told by the doctor that I just need to take some rest. The doctor asked me to drink plenty of water because our body sometimes needs time to recover. And initially I thought, huh? What is it? Why did she not give me any medicine? But later I realized that the doctor was not simply ignoring the problem. She was saying that if the illness does not require any medication, then why to take any medication unnecessarily? But in my country, whenever you go to a doctor, they always put injections in your body, they always give you medication. But in Germany, it is not necessary that the doctor always gives you medication. But it also does not mean that they never give you any medication or they don't prescribe anything. Yes, they do give medication. They do prescribe medication, but only when it is necessary. And I am talking this all from my personal experiences. And the other thing I want to tell you that don't assume that every medication, every tablet, every medicine you know from your home country will be available in Germany. Exactly the same way as it is in your country. Most of the medications here require a prescription. You cannot get them without any prescription from the doctor. There are many medications also that can be directly bought from the pharmacy, but there are many for which you need prescription. Without prescription, you cannot take that medicine. And with German public health insurance, medicines are generally covered. Although patients sometimes have to pay for it, but mostly it is covered. Like I paid for some medicines, but My 99% of medical bills were covered by my insurance. So, my advice is not that you need to bring a suitcase full of medicine from your home country. My advice that you should know what medication you take on regular basis. Bring the appropriate documentation. With that prescription, you can visit a doctor and tell the doctor that you are taking this kind of medication, this kind of medicine in your home country, and you need it here also. The doctor will check. If you need that medicine, the doctor will definitely prescribe, and then you can take it from the pharmacy. But if you are unsure about a medication, you have to ask a doctor or at least a pharmacist before assuming that it is available without a prescription. You always need doctor's prescription to take medication, to take medicine from the pharmacy. And another thing that surprised me the most is that finding a doctor is not as difficult in Germany as people tell on internet. People say that it is very, very difficult to find a doctor. I don't think so. Here in Germany, you can have a house arts. In German, we say house arts. In English, you can say family doctor. You can have a family doctor, and your house arts becomes your first point of contact when you have any health problem. I personally book appointments by calling the clinic or by using Doclib app. You can also book appointment by email. Now I move to the point that what doctors actually ask you when you visit them in Germany. When you visit a doctor, they commonly ask some different kinds of questions like, is there any medication you are taking regularly? Are you Do you have any kind of allergy? Do you have any medical history? Are there any other existing medical conditions? And after taking your history, then the doctor decides what to do next and what medication they need to give you. Sometimes, after asking these different kinds of questions, they simply prescribe medications. Sometimes they ask only to take rest and drink plenty of water. Sometimes they prescribe more tests for your body, like I had CT scan, I had X-rays, I had many other tests from the body. Sometimes the doctor refers you to another specialist. Sometimes they say go home, rest, drink water, come back if it's not cured. But it never means that the healthcare system is the problem. I would say that it is one of the best things that the doctors don't unnecessarily prescribe any medication. They only prescribe whenever you need, whenever they think that it is good thing or it is necessary to prescribe any medication. Sometimes people lie about German healthcare system, and this is probably the worst and the biggest lie about German healthcare system. And I disagree with this stereotype. People often tell me that it is impossible to get a doctor appointment in Germany. My experience was totally different. From my experience, I would say that things don't work like this as people tell on internet, on YouTube or any other different platforms. So my experience is different. Does appointment take some time? Yes, it takes time. I have also waited to take appointments. But it does not mean that you cannot get an appointment. Your appointment depends upon your urgency. If there is an urgent matter, if there is an medical emergency, then you can get the earliest appointment. But if there is no medical emergency, then you may have to wait. And I think it is worth it. The patient who are more sick, who are in serious condition. They need the earliest checkups and the earliest medicine. And if you are not sick, or if your condition is not so serious, then I think it is worth to wait it. So here is a question: what actually is an emergency? If there is a life threatening situation, you can simply call the ambulance. You can simply call 112 for any kind of life threatening emergency. And from my personal experiences in Germany in last 2 years, I have called the ambulance, or I have called 112, the medical emergency helpline, at least 2 times. For the first time, I had an workplace accident. I came back home. At that time, I did not feel too much pain. I thought it was okay and it will be recovered soon. I had a knee injury. And after coming home, after some time, I could not even move my leg, my knee. So I had to call the ambulance. They asked, "Cannot you go to the doctor by yourself?" I said, "No, I'm unable to move my leg also." Then this was a real emergency. The ambulance came as quickly as it was possible in just a few minutes, maybe 2 or 3 or maximum 4 minutes. It did not take time more than this. They took me to the hospital, and then I was admitted there, I was treated there, and then I came back home. And for the second time, I had an other accident. Just a few days ago, I fell down from my bike, and that was really a weird experience of mine, and I don't want to recall that. When I had an accident, I simply called the ambulance, and I simply called 112, German medical emergency system. The ambulance came. I was not completely into my senses. They came, they gave me first aid on spot, and then they took me to the hospital where I was admitted, and I was treated, and after that I came back home. So I would say that for those medical problems that are not life threatening, especially when regular working hours, where regular practicing hours are closed, you can simply call 116 117 or teledoctor or medical on call service. It can help you to appropriate care. It can help you to find the earliest appointment. So in Germany, whenever someone says that I could not get an appointment for tomorrow, it is very different from that I have a medical emergency and no one will treat me. So I would say that in medical emergency, you can get the quickest treatment. But when there is no emergency, maybe you have to wait for long time. And these are two completely different situations. Problem is that people mixed them together while talking about German healthcare system. From my personal experience, I say that it is one of the best systems in the world. I have experienced medical healthcare system in my country, Pakistan, and in Turkey also, and I find German healthcare system the best one. If talking about doctors, I would say that you whenever you want to stay in Germany, you have to learn German. From my personal experiences, as I can speak German, so I never had any problem with the doctor, because the doctor also speaks German and I also speak German. But still, there are many doctors who can understand or who can speak German, speak English also. And there are doctors who can speak other languages like Arabic, Turkish. So better is that you should know German, or if you don't speak German, still it is okay. When I had the first emergency, I called the first time ambulance. I was taken to the hospital. I was in complete senses, and the doctor there asked me, do you speak, which language do you speak? I said I can speak German. They said it is okay if you, we can also arrange translator, we can have other doctors also who speak other language. If you need any other language, just tell me. And I said no, it is okay, I can speak English also, I can speak German also, and I think it is more than enough. And then they said okay. So it means that better you should speak German. But even if you don't speak German and you have an emergency, but your lack of German knowledge does not stop you from getting treated well. People also confuse doctor's appointments in Germany with specialists. So if the, as I earlier said, if there is no medical emergency, you cannot get an early appointment. Maybe you have to wait for months or maybe a few days because it is no emergency. I visited some specialists also. Like right now, I am healed. I had a accident. I had an accident a few days ago. I am visiting house arts. I am visiting a specialist. I am visiting a physiotherapist. So at one time, for one medical condition, you may be visiting three or four or more than one doctors at the same time for one medical condition, and that depends upon the seriousness of your case. I also had experience with physiotherapists in Germany. And again, the system is not necessarily call a doctor and wait forever. Like I had been with physiotherapists twice, with two different physiotherapists in two different conditions. I just simply called, emailed them, and I booked them. Or you can simply call and book the appointment. For public health insurance, physiotherapy and other services can be covered only when medically prescribed, and sometimes you also have to pay a little bit from your own pocket. Other than house arts, physiotherapist, different specialists, I also have dentists. And honestly, my experiences with dentists is also good. I met dentists in Magdeburg and in Ulm. The dentist I was visiting in Magdeburg was the highly professional as the and the most competent one. She treated me really, really well. Problem is that I had to visit her after every 15 days. So I had too many appointments with her, but she treated me really well. She did root canal and many other stuff on my tooth, and it was everything, it was paid by my public health insurance, my technical kranka se TK health insurance. Other than that, I had an experience with dentists in Ulm also. Here I had to pay for my appointment, but a doctor, before your treatment, the doctor tells that you may be charged for this service, and this service is totally covered by your health insurance. From my personal experiences, I had not to wait for medical appointments because two times I was admitted to the hospital in an emergency situation, and other than that, I had appointments with doctors, with the dentists. That was not an emergency situation. So I called them, I emailed them, and I got appointments in next 3, 4, or 5 days. No later than that. I had been with the physiotherapists. I called them or simply emailed them. And for physiotherapist, you need a referral from some other doctor. So I called the physiotherapist and I got the appointment in the coming week, in next 3 or 4 days. The only frustrating situation for me was then the longest time I personally experienced was for bodily tests. And honestly, that was even not an emergency. For those bodily tests, I had to wait for 5 months. And this was the longest waiting time I ever, ever, ever experienced in Germany in these last 2 years. Other than that, whenever I needed to visit a doctor, or whenever I needed an appointment, I got the appointment in next 3 or 4 days maximum, not more than that. So I would say that the people who say that German healthcare system is worse or you cannot get an early appointment, I think that they lie. At least my personal experience is totally different from them. So does it mean that I am saying that German healthcare system is the perfect one? No, I don't say that. There is always room for improvement. There are many other things that can be frustrating for you, like sometimes waiting times can be frustrating. Sometimes the system feels bureaucratic. Sometimes specialists are difficult to reach. Language can also be sometimes problem for you. Even the doctors can speak, or even there are doctors who can speak your language also, but still it can be difficult to find the doctor who speaks your own language. But still I would say that it is patient's problem that he or she does not speak German language. But still these problems are not the very serious problem. You get proper medication, you get proper treatment, and I think it is one of the best thing of German healthcare system. From my personal experiences, I would say that my experience in German healthcare system is much better than the stereotypes I have heard before moving here. Sometimes I wonder why people say that German healthcare system is bad. And maybe this is the real question. Why do I hear so many stories about people waiting forever for appointments? I think there are some reasons for it. First, people remember bad experiences more strongly. They don't remember good experiences. If you wait 3 months for an appointment, you are definitely going to talk about it. But if you get an appointment tomorrow and everything gets smooth, and for that nobody will make a 20 minutes video on that, but I am doing it. I had personally very good experiences. I got the earliest appointments. I was taken to the hospital. I got the best medical treatment, and nobody talks about it. People only remember bad experiences. Nobody talks about their good experiences. So I think that the second thing is that healthcare system varies depending upon your location in Germany also. So getting a routine appointment with one type of specialist is not the same as getting emergency treatment. So whenever someone says that German healthcare system is too terrible, I don't think that this statement is right. The better question to ask them is that what exactly happened to you. From that you can imagine or you can have an idea what exactly happened to them and what was the actual problem. So if I talk about my overall experience with German medical system, I have been with the Hausarzt in Magdeburg, in Ulm. I have been with the physiotherapist in Ulm. I have been with the dentists in Magdeburg and in Ulm. I have got different medical tests. I have been into the admitted into the hospital. I have been into emergency twice. So from all my personal experiences in these last 2 years in Germany, I would conclude that I am satisfied with the healthcare and with the treatment I received in Germany. Not because everything was fast, not because everything was perfect, but because when I actually needed some medical care, I was able to get it. And that is what matters the most to me. And I also appreciate the fact that doctors don't automatically treat every problem with medication. Sometimes they don't prescribe any medication. Sometimes the advice is simply just go to home, take rest, drink plenty of water, and wait. And if the problem still remains the same, come back again to us and we will give you some medication also. This may sound strange to someone coming from Pakistan or India or any other country where it is necessary for the doctor to give you medication to treat you with injection. Here, it is not necessary that every time the doctor gives you medication. So, my experience is the best one. So, to conclude, I would say that if you are planning to move to Germany, don't move here thinking that German healthcare system is terrible. But also don't move here thinking that it is the perfect one. No, both are lazy conclusions. You should expect bureaucracy. Doctors have to do bureaucratic work also, administrative work also. Expect that sometimes doctor's appointments may take time. Expect that you might have to call several practices, but also know that there are different levels of medical care depending upon how serious your situation is. For non life threatening medical problems outside normal office hours, you can simply call 116 117. And for life threatening emergency, you can call 112. And the most important thing I would say that don't ever judge an entire healthcare system from one bad appointment. I have good experiences. People also have good experiences. I never had any kind of bad experience, although I have waited also. But I also got treatment quickly. I have been taken to the hospital by ambulance twice, and the ambulance comes in just a few minutes. For the second time, when I had an emergency just few days ago, the ambulance arrived in 2 minutes, I think, not more than that. So now tell me, how's your experience with healthcare system in Germany? Or what is your experience with healthcare system in your own country? Tell in comments. In Germany or in your own country, did you have to wait for months for an appointment, or did you get that treatment quickly? Tell me your experience in the comments. And if you are planning to move to Germany, follow me, because I will keep sharing the things I wish someone had told me before I came here. Follow, like, share, and subscribe for more videos like this. And if you want video on any topic related to Germany, just tell in comments and I will try to share my personal experience, and I will try to make a video on that also. Follow, like, share, and subscribe.